At the present time, there are three major bills that are being considered in Congress, two on the Senate side and one on the House side. And I think after the summer, we got through the sticking points of the death panels and debates about covering illegal immigrants and abortion, has come up as a sticking point as well. I think in terms of public discourse, we're a bit past those issues right now, and the major sticking point right now is the public option. Two of the bills being debated and discussed right now do have a public option, a government run and sponsored health insurance option for people, and the one bill on the Senate side, the so-called Baucus bill, does not have a public option in there. And people really are drawing lines in the sand. There are many people who believe politically that a bill with a public option won't fly because there is resistance to it, mostly on the Republican side. There are also some people drawing a line in the sand and saying they won't support a bill without a public option. Well, healthcare reform is like the proverbial onion, the layers that need to be peeled. So, of course, as sticking points get resolved or move beyond, you peel that layer of this whole incredibly complex process, and then you have a new issue emerging. And so I do see several potential issues emerging. And one thing we have to keep in mind is these bills are incredibly complex. They're hundreds and hundreds of pages long, and they're all really trying to do a lot. And one that I think is really there right now at the forefront, and certainly people on the Hill are talking about this a lot, is the whole issue of the insurance mandate that is present in all three of the major bills that are being discussed right now. So the insurance mandate is similar to car insurance mandates. If you and I want to drive our car, we have to have insurance for that. So all three bills are proposing that we mandate that all citizens purchase health insurance. There is another sticking point, I think, as well, that hasn't really reached the top, bubbled up to the top of public discourse and concern right now, and that is the fact that all three bills also expand current public programs, Medicaid and the S-CHIP program, the State Children's Health Insurance Program. All three bills have significant expansions of these public programs. These public programs, while they involve federal money, they also involve state money, and we know that states right now are suffering incredibly with budget crises and economic crises. Certainly we here in Michigan are feeling this tremendously right now. So the cost question obviously is going to come up. Another concern is that the penalty proposed in a couple of the bills is perhaps not stringent enough, $750 penalty for not complying with the mandate. Some people might choose to just forego getting health insurance. That would be cheaper than paying the penalty. We're trying to do so much with one piece of legislation. There's health insurance industry reform. There's health insurance market reform. There's healthcare system and quality of care reform being proposed. And then there's prevention and wellness and health reform that's in these bills. So we're trying to do so much. And as the president said, that really people can pretty much agree on probably 80% of these bills. And I hope we can preserve that and actually move something forward and get it passed.